Many times I'm asked, is non-surgical spinal decompression painful? I've had several patients indicate that they put off coming to me because they were in another doctor's office where a patient complained that they were undergoing pain and being treated. Quite often this actually would indicate that in fact it's not decompression therapy that they're actually receiving. And the reason that is because the body, especially when it's in pain, has a protective mechanism. And so therefore, when traction is applied, which is basically a set amount, it goes up to that amount and it stays at that amount. Many times when a person's already in pain, it's going to trigger a muscle reflex contraction response. And by doing that, what actually happens is it creates more intradiscal pressure and actually does the opposite of what they're intending to do in order to treat the back pain by doing traction or sciatica. This is not the case with spinal decompression. What is unique about spinal decompression is that a true non-surgical spinal decompression machine, and there's only two by the way, they are DRX and VAX-D. They utilize a proprietary logarithmic curve that is something that Dr. Alan Dyer, who was one of the chief engineers and main contributors to the invention of the heart defibrillator, discovered was necessary in order to create the muscles around the spine to relax actually during treatment. And now a lot of the tables and technologies that we utilize have what we would call biofeedback. That is, the table actually is able to sense that the spine is contracting or tightening, or that the patient is, and therefore it will actually relax. In the original version of VAX-D, which I did for over 10 years, that was not the case because there was no feedback. Although it was computer monitored, the reflex was not. And so therefore, in the second generation, we're actually achieving greater decompression, lower intradiscal pressures, without having to actually increase the force necessary to do so. And so therefore, a lot of the newer cases that we're seeing with patients, they're actually, most of the time, asleep the entire time while they're on the table for over 25 minutes. So there's no pain. Most importantly, I've heard possible complaints of screaming, loud noises. This definitely should not be the case when a person is being treated. My advice generally with any activity is, if it hurts, stop. And that would, of course, be my recommendation during treatment. Therefore, each patient actually has a stop button that they can trigger at any time, which will completely stop the treatment. So I hope this has been helpful for you. Thank you for watching.